Welcome back to TV5 News at 9. Today we are talking about recurrent cancer with McLaren Proton Therapy Center. Joining us this morning is Director Dr. Hashim Gayar. Thank you, Doctor, for being here this morning. Appreciate it.
Thank you for inviting me.
Of course. Okay, tell us, Dr. Gayar, what is proton therapy and what are the benefits for patients?
Proton therapy is a form of radiation treatment, and as we know, radiation kills cancer. And the point of giving the radiation is if we can focus the dose of radiation at the target and spare surrounding tissue, it's called the therapeutic ratio, and that improves the outcome by killing the cancer. And if we spare normal tissue, we improve the quality of life and reduce the side effects. And proton therapy, instead of conventional radiation, where the beam goes through tissue, exit from the other end because it's electromagnetic waves. Proton therapy, on the other hand, is a particle therapy. So imagine shooting small, tiny spots, three-dimensionally in tissue, to the target where you want it to be. And those spots go in with minimal dose, diffuse at the target, and stop with no exit. So that reduces the dose of radiation to normal tissue surrounding, and hence it improves the quality of life. It reduces the side effects. If the radiation is given after surgery for microscopic disease or definitive to cure the cancer as a primary, it allows us to give good doses, higher doses, cure the cancer with better quality of life and less side effects.
Oh, sure, patients love to hear that. And doctor, tell us, sometimes when cancer returns, patients are told, well, they can't have surgery anymore. So is this true as well for proton therapy?
No, we have, first, the problem with recurrent cancer is cancer coming back after the initial surgery or after the initial treatment, and it's always not only bad news for the patient, but it's a difficult problem to handle. And technically, it can be challenging to the physicians. With previous radiations given, it sometimes is a limit. We cannot give radiation again. But this is not the case for proton therapy. Because again, it's selective and we can focus it and we can spare normal tissue. That pinpointing three-dimensionally that we can do is unprecedented. And it can allow us to treat safely where the conventional radiation stops. So when some patients, we used to tell them, we can't help you. Now we have another tool that we can in many cases. And we can also use it with immune therapy, targeted therapy, that we can have beautiful regimens and new protocols and research going on as we speak for new applications to cure cases, even when patients thought no more can be done. So we're seeing that more and more every day, and we're getting patients from all over the state and neighboring states as well, and Canada.
I'm sure.
We're being able to help.
Yeah, that is very popular. I'm sure people would love to get this. Now, how can people find out, doctor, if proton therapy is really the best treatment for them and for their cancer?
Well, first of all, if radiation is indicated in your care or you have been discussing with a radiation doctor, find out the options before you proceed. And it's very simple. You can call us to find out, and our team can help you. If you need to be evaluated, we can look at records and review the cases. Just call 855-MY-PROTON or get in the McLaren website and go to mclaren.org at Proton Therapy. And I think you can show the message. We can discuss the case, evaluate it, talk with your doctors, and as a teamwork, we can help you decide if this is needed for you or will help you or not. We can also accommodate patients that are traveling because we have a nice hospitality house right next to the Proton Center. And now insurances and Medicare approve proton therapy more than before, and the clinical utilization has been shown to be very effective.
Oh, that's very convenient to have that house right nearby. Tell us also, doctor, anything else that we haven't covered that you think is very important when people are considering this or they need to know more about proton?
I would say the sites where this second or the recurrent cancer can occur is often in areas like head and neck cancer or colorectal cancer coming back, lung cancer coming back. And all those areas, there are critical structures. So if we can retreat lung cancer, or even first time, it doesn't have to be done only for retreatment or recurrence. We can do it first time for first cancers to show. Anytime the cancer is close to critical organ, there is value to radiation. So in lung cancer, you're close to the heart, you're close to the lungs, the airways, the major vessels. In prostate cancer, you're close to the rectum. And in recurrent head and neck cancer, there is many structures. You're talking about the brain, cranial nerves, spinal cord, salivary glands, and all those factors affect the quality of life. So whether it's first-time cancer diagnosis or cancer coming back after previous treatment, those locations, it makes a lot of sense to consider. Another location is breast cancer on the left side. It's so close to the heart that even the first-time radiation, some small beams of radiation happen to go to the heart. And data has shown, studies have shown that even very small doses to the heart can lead to problems with the heart later on. And proton has the advantage of stopping at the target. It doesn't cross the ribs. By photon radiation, unfortunately, there's always some beam scattered. So if you have left-sided breast cancer, you want to consider proton therapy before you have conventional radiation.
Well, Dr. Gayar, you've given so much hope to so many people out there today. I know you have. Thank you so much for stopping by. We appreciate you.
My pleasure, and thank you for inviting me. It's always a pleasure to be at your station.
Thank you, Dr. Gayar, and thank you again for listening in. You can find out any more information about this topic in the Hot Link section. That's on WNEM.com.